This is our first attachment conversation of the spring semester. It's our 4th semester in a row doing these talks, and I really enjoy them. They're part of what I really look forward to in the semester. I want to let you know, since the spring semester is a bit different, we will only be meeting once a month this semester because of the schedule in Ramadan and the holidays coming up. So we will have one speaker every month, and I'm very happy that we have Dr. Nayla Grace with us today. Before I introduce her, I want to remind you please to scan the QR code in the room and register that you were able to attend today. We're also recording. And we will be posting the recording after the semester, inshallah, as a resource. And I'm very grateful that our speakers are always excited about this because I feel like this is such an important resource for others who are interested in such topics. So Dr. Nayla Grace is a consultant psychiatrist and medical psychotherapist. She is the founder of the inpatient and outpatient dialectic behavioral therapy program at Behmen. She's also trained in CBT, DBT, and prolonged exposure therapy for complex PTSD. I am really happy to have her with us today. She's one of the people on social media, Kaman, who's raising a lot of awareness regarding topics in a way that I think is different from what we usually find on the mainstream media, and I'm very happy about that. So welcome to the lab and to the attachment conversation.
Thank you, Dr. Noor. Thank you, Gad. I'm really grateful and very happy and very excited to be here. And honestly, I'm really amazed by what's happening here, what you're doing. It's really very much needed. I was just telling Maya how like replicating these studies in the Middle East is of really utmost importance. A lot of the things that we read, I find that there's so much underreporting in our area that, because of the shame and the stigma and fear of talking about especially when it comes to addiction. So once we start to talk and sort of normalize these topics, it becomes less of a shameful topic.
The conversation changes
Exactly. Your introduction was perfect, spot on. I am a little bit about myself, just to add on. I'm a medical doctor, and I'm also specialized mainly in dialectical behavior therapy, which is what I do now with both inpatient and outpatient population.
Okay, wonderful. Can we start by you telling us a little bit about what got you interested in the field of addiction and the context that you work in?
I've been thinking about this question a lot, how to answer it. What got me interested was how I noticed when I saw people with addiction problems, they would mainly report. I'd see it a lot in their admission files and they'd say their childhood was uneventful. Uneventful, everything was okay, nothing is wrong. فالموضوع ده كان صراحة made me really question what, and reading and understanding a little bit more about the trauma and addiction link. And a lot of people believed they had a very happy childhood, and believed that, and they sort of normalized their experiences. And when we looked into that and started to ask further questions, noticed in 1 second, because it was so difficult to believe that my parents who love me are also the same people who they're doing the best they can. None of this is to say that we're going to go out and blame our parents, but that they're the same people who are causing some form of harm on me, or I'm not able to talk to them. It's so difficult for a child to integrate both these concepts.
Yes.
But they either think that their childhood is happy and everything is fine, and then go out and deal with the world, or it's so painful and they push down these feelings and use ways of coping, like self-medicating, and then the attachment comes in, that it's ruptured and so on.
There's also the cultural aspect of feeling a little bit guilty to talk about how my childhood might have been a bit of a struggle, or how my parents might have contributed to some of the issues. There is a little bit of guilt sometimes that also comes with that, I guess.
Of course. It's like the family here, because I think we were talking, like it can be both a protective factor and also a big risk, that there's so much over care and over concern. فإزاي this my parents who love me so much and they provide so much, and at the same time, it can be a source of support.
Yes, true.
So that's one of the things that got me interested, to see how under-recognized trauma is related to addiction. And it's just, one second, we need to just validate. And there are reasons why people do this and resort to these behaviors, whatever addiction we're talking about.
Yeah.
Like, we're not going to use drug addiction, but
Yeah.
even behavioral addictions.
That brings me to my next point, so that we're all on the same page when
Yeah.
we're talking about addiction today. Most people would think about alcohol or substance use, for example, when they're referring to addiction, but we know that addictive behaviors can really include so many other behaviors.
Yeah.
So can we
Yeah.
define addiction? Can
Sure.
we clarify what does it include when we're talking about it?
I did a bit of brainstorming. I thought about this. DSM would say, there's 11 criteria and there needs to be 2 over a 12-month period to say, and then according to how many, there's mild, moderate, severe, and there needs to be something called loss of control. The main thing is I want to use, let's say I want to have 2 glasses of wine, I end up using way more and I can't stop and there are negative consequences, and really narrows it down to drugs and alcohol. If we look at it, for example, from the DBT lens, it's seen as a way to solve a problem. I have a problem in life, I can't control my emotions, I can't manage these painful feelings, I'm so phobic of how I'm feeling. It's terrifying, so that is a problem and I'm going to try to solve it. Gabor Mate, I think you're all familiar, and I'm one of my key major influences in the way I think and the way I operate, also work with patients, and has helped me personally a lot. Really broadens this perspective of addiction. He defines it as any behavior. You all think about this yourself, because if I apply this to myself, I can think of so many things. Is that any behavior that I crave and that reduces anxiety and has pleasure, get some pleasure in it, and for me, social media, I have to admit, and it causes some negative consequences, and I can't stop it. So he's really broadened it.
Yeah.
So does anyone have any addiction here?
Yeah. Yeah.
So but he's also kind of really made it seem like, okay, we're all somehow addicted to something. But if we're going to talk about substances, that's also, the American Society of Medicine, they say this is a brain disease. There are circuits in the brain that are not working properly. I think it's really complex. I don't have an answer to what is there's so many definitions and there's so many views. I think it's a very complex physical process that has so much interaction between how vulnerable a person is and how they're interacting with the environment.
Yeah. But that perspective that you're talking about also removes the shame from the equation, you were saying at the beginning, because usually there's a lot of shame surrounding conversations related to addiction. So I'm happy that we're starting by opening up the definition a bit more to include behaviors that we all can relate to, actually. And I want to get a little bit more into trauma. There has been a lot of research about how trauma and addiction can be related in some way. How do you see that in your clinical practice?
I see, honestly, if you want to know the truth, 100%.
Okay.
And I'm going to define trauma as what didn't also happen. It doesn't need to be abuse, but it's also neglect.
Yes.
I'm going to include neglect.
Sure.
And I might be really stretching it a bit, but if we look at most of the things that I've read, roughly, consistently, that we're talking about 80% of women, at least what's reported, have had some sexual trauma. And men is a little bit less, but I think it's because it's not reported as not. And that doesn't come from what we know in Egypt, by the way. I don't know what's been documented in Egypt. There is a big link, and I want to add how that is on a biological level.
Yeah.
That's really, really important.
Yes.
How that, if I can add, the relationship between the stress that happens from the lack of nurturing, the lack of consistent caring, the lack of presence from our caregivers, and what happens to our brains. I like to always use that metaphor of a car. Like a car, if there's an alarm, what happens? It just goes on. That's the biological, that's what happens in the brain. Like that's the amygdala starts to fire like this because of like the stress that the brain is under, specifically something called cortisol, which is, we know it's toxic to the brain. Like certain areas shrink, but the amygdala specifically increases in size. So once a person starts to use drugs, and like if we haven't formed that proper attachment, endorphins, which are responsible for like that bond, basically, mother and like, I don't think I'm gonna tell you guys are the experts here, to relieve that pain and to create that connection, that secure connection. On the opposite, the person is on high alert, constantly high alert. So once they take that drug, it becomes such a powerful way of taking away that fear, anxiety, that, whether it's even depression or emotional pain.
Which keeps the cycle going,
Exactly.
because you need that again to have the same feeling again.
And that amygdala, which is so important for survival. It's like we share this part of the brain with like our snakes, basically, for survival. It kind of signals that this is needed to stay alive.
So it has a sense of urgency also that comes to it in that sense. Yeah.
Exactly. For the role of trauma is, I think it's under-recognized from my perspective.
Yes.
I think it's not stated enough. That's why I really believe like that. Like with the ACE study, we were just talking about like how it's like what we know is that the more ACEs you have, the more like correlated. There's a higher correlation for earlier onset to come in.
ACEs being adverse childhood experiences.
Yeah.
Yes. Before I get more into attachment, do you think that there are specific types of trauma that are more correlated with addictive behaviors?
I think sexual trauma, like we know with women, sexual traumas, we know that if they've had, reported sexual trauma, there is more likely to start using alcohol specifically earlier. And definitely if there's the combination, definitely the likelihood of starting and escalating the use earlier, that's what we know. But I think all three types of trauma, like emotional, physical, sexual, all of them in a way are related to, onset of use and earlier onset of use.
Okay. Yeah. When you were describing this cycle of how addictive behaviors can develop and how can they be maintained, I'm also thinking about emotion regulation of the person probably playing a big role in that cycle, because you're essentially saying that the person is using a substance or alcohol or behaviors in order to soothe or in order to regulate, right?
Yes.
So how does emotion regulation here play a role?
It plays a huge role. It plays a huge role in if this endorphin surge hasn't happened in the child. Like, imagine a child right now, like a newborn, starts to cry. What's meant to happen? Like typically, if there's a mother, that's the scenario. The mother will respond by hugging, touching. All of this stimulates in the brain really important neuronal pathways and receptors. And they've done animal studies as well with rats to see how if they actually removed this endorphins and these receptors, they're not responsive to the mother. They become kind of detached. So when this doesn't happen, the child starts to rock, bite their nails. And then we know teenagers or people start to use drugs early. When they develop substance uses, it's usually early. Like the majority of people start like experimenting early. The prefrontal cortex, the part that's right before your forehead, that is the part that's supposed to like, if you see a new iPhone and you think that's amazing and how many like pictures you're gonna take, then you have to pay rent and you have a lot of things that are due. This part tells like, don't buy it now. But with teenagers, that's not formed. So when I start to use substances, like early on, this part hasn't yet formed. Like it's not yet fully developed. So it's really reinforcing. This is amazing. I'm going to take it. And also, like the part of the brain that helps us regulate our emotions is also not yet formed. So that cycle just maintained. It's so crucial for survival, and I don't have something to slow me down.
With teenagers, come in, I think there's this illusion of control. Like I'm invincible. I know what I'm doing.
Exactly.
I can experiment,
Exactly.
and I will not get
Exactly.
addicted.
Yeah. But that's why, like, there's that, no voting before a certain age, no using substance. But it's that because there's no, the brakes aren't formed, right? Because they can't weigh, like, this is risky,
Yeah. So if we look at addiction in form of attachment adaptation, I'm adapting to something that I didn't get, which you were explaining. So there was a lack of a certain type of care or connection, and I'm trying to compensate for that with addictive behaviors instead of looking at it as a pathology. So if we stay within that lens, can we try to dig in a little bit deeper into different types of insecure attachment, مثلا anxious and avoidant attachment? Do you think addictive behaviors look different for each? The cycle goes differently. Like, what are the differences? How do they adapt differently using addictive behaviors?
When it comes to attachment, I think we're talking about like different levels of security. So like somebody who is insecurely attached, there's a different level of security than someone who is, we call avoidant or attached. And it's just how secure I feel in this world. And when I wasn't reinforced from, I didn't get that endorphin surge, and I wasn't able to calm myself down, none of this has been formed. An insecurely attached person is, I didn't get that consistently. I wasn't able to get it consistent. So I'm constantly afraid. I'm afraid that I'm going to be rejected. I'm going to be abandoned. Overall, like what I've noticed from, most studies I've read, there is a very, very high degree of, correlation between people who are insecurely attached and substance use disorders. And those who seek or use stimulants are using stimulants to get close to people. They want to, they seek closeness. They want to get close to people because they're activating drugs. Those who people who are, we talk about the avoidants, who are, whose caregivers were more distant, who knew like, okay, if I get close, I might be punished, or wasn't allowed to feel my emotions. This is not safe. I prefer to be more independent. Use those more deactivating drugs, or the ones that are like hypnotics and downers. Again, only from what I've noticed from, what I've read. Both, like those who use opioids can fit into both. Then those who use alcohol are sort of very heterogeneous. But consistently, the most of the population have a bit of this, a bit of that. And those who fall into this disorganized type, who are like, a little bit of the securely attached, and also the fear closeness, they're very externalized in their behavior, very more impulsive.
Okay.
Yeah.
I want to get more into the therapy part. If we don't take these things into consideration, if we don't get trauma and attachment into this equation, how does the traditional addiction treatment model look like, and what do you think it's missing?
I don't think attachment is talked enough about in traditional addiction. I don't think, because these attachment really works on very specific emotions, like sadness. So when I lose something, like my primary caregiver wasn't available, this triggers sadness in me and panic. So targeting this emotion and grief is really, really important. The only treatment that I've seen so far that actually like addresses attachment is dialectical behavior therapy, and most other treatments may be doing it in one way, other way, addressing it. But with DBT, we know that people will disappear. For example, they won't come back if they start using substances. So we actually address it in the beginning of treatment. We actually say like, if you do use, you're going to disappear, and how am I going to find you? Because of the shame.
Yeah.
So we speak about it.
Yeah.
As an attachment,
Yes.
a way to address attachment problems in clients.
Okay.
I don't think it's talked about, I don't think it's assessed even with intakes. I don't think we talk about it, to do a specific, adult attachment interview. I think it needs more attention because for treatment, we develop relationships.
Yeah.
So attachments develop with your therapist. Attachment develops with your peers in hospital. Attachments develop with your families. So I think there's more to be talked about when it comes to attachment in general.
I'll come to this point specifically about the therapeutic relationship because it's very important. But when you say that trauma مثلا or attachment are not really taken into consideration when you're taking the intake مثلا of the client. So in your approach, what you use in your clinical practice, you do ask about background in terms of trauma and attachment, and these are topics that you address in the treatment, right? So to clarify that you focus on that in the treatment plan itself.
Yes.
Okay. And there are some modalities مثلا that encourage the client to identify with addiction, like to say I'm an addict, for example. Are you pro or con this or?
The anonymous programs, basically, are anonymous programs. Has anyone heard of anonymous programs? Yeah, the 12-step model. Yeah. So when you go into a 12-step meeting, one of the things that people are encouraged to do, you don't have to do it, but are encouraged to do, is to walk in and say, "Hi, my name is so-and-so, and I'm an addict." I think there are lots of benefits to this, and I think there are also a lot of things that could be seen as not very helpful, but I think that overall, it really encourages the honesty and accountability, and really in line with the first step of the program, which is admitting I have a problem and I am powerless, and I am, I'm that denial of I don't have a problem anymore, which keeps people a little bit stuck for years, and it also helps people foster community, that we have this together, we're all in this together. What could be seen as a potential disadvantage, I think, is really identifying and labeling oneself. This becomes who I am. This is who I am. I'm stuck with this for life. Although it's important, to stay vigilant and to keep that identity, so to speak, or to know I have this, because it's without that you kind of risk not doing certain things for your recovery. But if it becomes only who you are, and you become so really powerless and you lose your agency, that's where things could be seen as a potentially not a disadvantage with that way of identifying.
Yeah, that makes sense.
Yeah.
And aside from all the interventions that the therapist can use with the client, the therapeutic relationship which you were referring to لسه دلوقتي, how can it be used to support the client's recovery or their journey برضو?
To show that we are both, this is a secure relationship, if things go wrong, which they could go wrong, and we disagree, I'm still here for you. And to model, if, you want to tell me something, how he may bring something up that's potentially uncomfortable. And, model that I'm still here for you. I'm not going to disappear. Sometimes people have a lot of difficulty saying, by the way, what you did, I didn't really like. They'll shy away from that. Or by the way, telling your therapist or calling your therapist out on something they didn't like. They may want to avoid that altogether.
So having that space. Is
so
important.
Exactly.
Well, if someone is here today and they have a friend or a family member who is struggling with addictive behaviors or a certain type of addiction, is there something that you think, not in a therapy context, but more about social relationships, people around us in our circles, how can someone be helpful in these situations? How can you support? How can you do's and don'ts, basically?
Do's and don'ts. Yeah. Okay. I just want to say one thing first, is that if somebody is not ready to manage their lives and is not ready to change their lives, I don't think that there's anything anyone can do to make them change. And that's the most important thing I would say. But I think there are many things that can be harmful. Because I think there's a big difference between like enabling and being supportive.
Yes.
Yeah, I think the enabling part is where a lot of times I see in our culture, because of extended families, and is it because I want to get my needs met by taking care of you? That's codependency.
Yeah.
And it's so, when you're in it, it's very hard to sometimes see. Because the person can be like, family members become very self-righteous and they become like, it serves their need. At the same time, how do we support by, setting consistent boundaries, by saying, I love you, and be compassionate. Like, I can see that what you're doing it's painful for me and it's painful for you. To see this as like how the person's actually also, they're not doing it to harm me or to harm you. They are hijacked by a certain biological process in their brain. And not to take it personal. That's the most important thing. Because their brain is already like very vulnerable because of these, inconsistent caregiving, no caregiving at all, neglected, took a drug that felt amazing. This is crucial for my survival. I'm going to do it again and again and again and again. So if we view it from the lens of this person is actually like possessed. Like, I'm not going to use this word very carefully, but it is really like it is a matter of survival. Because if I was starving and I needed to eat, like starving, like no Uber Eats, no none of these things. Like, what am I going to do? This is how it feels like. But at the same time, like, I'm gonna you have to take care of myself. Like, I have to take care of myself spiritually, mentally, physically, because when I don't do that, addicted families, like, it's a family disease. We know addiction is a family disease. It doesn't affect one person. And in Masr, we are all like, there's no differentiation, right? So if you're upset, I'm upset. That's very common in families with addiction. So we need to learn to separate. I encourage a lot of support from groups like Al-Anon. These are programs similar to the anonymous programs that have, people who share experience if they have a family member who's addicted, a loved one who's going through something like that. It's tough. It's really tough because families live in despair and they live in a lot of stigma as well. They feel it's not something you talk over with a friend for coffee, right?
They can struggle in silence.
Exactly.
They can't really talk about it to others around them.
بالضبط. They sit with this pain, and then they think they might be helping when they're being harsh. Then the addicts become more isolated, or they think they're helping by giving money when they're actually not helping. Families need to get their own support, and also know what is okay for them, like not providing money, not allowing drugs in the house, and be consistent with that, and know that they have to take care of themselves. That's they could be showing up as a better parent that way for their child, because that might be the help that they need, as opposed to giving, or being super shameful about their behavior, and judgmental. And
which is not easy. It's a balance that's not easy. And you started by saying something, Kaman, I guess that's hard to take in by family members sometimes. No matter what you try to do, it's just not the time when it's going to happen, or the person is not ready. And that's very difficult for people to hear at times. I can't help, or I can't do more than this, and they just can't accept it at times.
And that's the reality, like you can't make someone, if a person's not ready to manage their life, and we can't make that. We can't create that time for the person.
But at least we don't add more harm, and we can be there every step of the way until they're ready. And then, you also mentioned culture and extended families. In our culture, do you think في حاجات that can act as protective factors وحاجات تانية particularly that are risk factors when it comes to the cycle أو
I think our culture, definitely there's still a lot of stigma around using drugs. And I think موضوع انت اقوى من المخدرات دي really downplays how difficult it is. يعني if it was that easy, just stop using. يعني it's just like, say no to drugs. That يعني لا، هو موضوع أبسط، يعني مش بسيط كده. I think that women don't get enough برضو attention. Like I've seen a lot بس إن هو men get more affected. Women seeking treatment برضو may be an area that لسه فيها شوية لا, we don't get enough يعني credit for, or مش credit, sorry, like يعني how much women also struggle في الموضوع ده. And I think like, and this I think is not just in our culture, but hash is a drug. Cannabis is a drug, right?
Surprise,
Right? Like it's so normalized. Like marijuana is addictive, right?
Oh, that's interesting. And we have this here.
فالموضوع ده still I think it really does كده, prevent, or people don't get treatment because they still think, oh, that's okay. But with our culture, obviously families, like we said, having an extended family can be very protective. Like if you go to other parts of the world, 18, you're on your own. I think there's that's the common idea that families they don't really provide and take care of you. But again, if they're enabling you, it could be seen as well, or it could be harmful. Religious background also is very helpful to have a strong spiritual connection. Like if you're in our culture, that could be something as a protective factor. Especially if when people start recovering, having developing a relationship with your God, or having a relationship in general, like having a spiritual life. So that's one of the things I find to be very protective here in our culture.
Okay, I want to give people the chance to ask questions.
Please, I feel like I'm talking too much.
No, يعني that's great, and I think you're really touching on points that we don't talk about very often, and it's a very different lens to think about addiction from that perspective that has a lot of compassion عن يعني the shame, the pathology. يعني it's a very different narrative, I would say. Any questions? Okay, start with you.
There's a very thin line between, I want to follow you, I love your comments.
Oh, okay, thank you.
There's a very thin line between how people get addicted to different things in general in الحياة, and I think a pattern that everyone has been seeing برضه is the addiction towards the phone that brings you so much satisfaction of attachment. As in, like, my friends are seeking therapy on ChatGPT, and there's so many apps called purpose and based on these theory, and everyone's getting actually addicted to that because they feel their attachment patterns are better that way. الناحية الثانية العالم كله بدأ يبقى فيه addiction units, digital addiction units في المستشفيات. Like there's so many countries having digital social media, including the Emirates مثلا لسه فاتحة like the full-fledged digital well-being thing. I don't know where's the thin line of when does this become comforting, addicting, and solving a real attachment issue, while it can make it worse. يعني أنا بالنسبة لي how can this be solved بحاجة ما ينفعش resist? No one can resist.
That's a great question. First of all, thank you. I had no idea that it became an actual diagnosis very soon. It sounds like it's and people do need treatment. I know the risks of using AI and like how harmful it can be when it becomes, I'm actually listening to this person and I'm taking advice, and how vulnerable people can be. I can only answer with how is this affecting the person's life? And I don't have enough information about. I know a little bit about AI and the psychosis and how if somebody's already at a very at-risk mental state and what has happened, and like the few cases of tragedies of that. But if when it becomes an addiction, I mean, certainly it's reinforcing. Like social media is very reinforcing, 100%. But how is it interfering with a person's life? And yeah, but thank you for that. I will look into it.
It's very tricky when you think about, because in some types of addiction, I guess the lines are clear, especially if you think about addiction to work. Being addicted to being super productive and to work. Essentially, you zoom out and you feel like, Meshi, the person has their life together and things are going well for them, but is it healthy? When does it cross the line? And this is when it gets really tricky, because it's not as clear cut, I guess.
Yeah, for sure, for sure.
Going on the same note of unconventional, not talked about addiction. Someone who's addicted to food. It's something that you can't necessarily live without. Which there are other substances where you can quit and then you can never come into contact with it again. حاجة زي food. How would someone recover? How would they go about that? مش حاسة I've heard anyone talk about it.
Yeah, 100%. This is, we're going to be talking more about eating disorders in that case, or emotional eating. I think that's more of we can't stop eating 100%, but if it, again, how is it interfering with a person's life? Especially emotional eating. A lot of people eat because they want to regulate emotions. And treating food as an addiction, I think, would be used the same way. Like, is the person, does the person have health issues as a result? If it develops into an eating disorder, I think then we'd be targeting and treating an eating disorder. But again, isn't an attempt to regulate emotions. I think we'd look at it from that lens. How is it as a way to cope with, emotion regulation strategies? Yeah. Thank you.
And I had a question.
You said that it's very important for the addict to recognize and acknowledge the fact that they're addicts, because it's like they're out of the denial. But since their whole life has become addiction, I feel like it's very, like, how can they identify with, like, yes, I'm an addict, but برضو not let that take over their whole identity, because and not like internalize it, because I feel like the lines are extremely blurred of like, yes, I'm acknowledging it, but once I acknowledge it, it really sets in because it's really heavy.
I think there are definitely advantages to keeping that on the forefront of a person who's an addict, to not lose sight of this is what I have, because it's important to stay vigilant. It's important to know that this is a condition I have and it's not going to go away. But if it's all I ever do and it's all I ever tell myself and it prevents me from actually taking steps in my life, and I'm become I'm not able to move forward, and I'm just living in my disease of powerlessness. I'm not doing anything in my life because it's actually preventing me, and I lose agency because of it. And I think there's a question mark here. I think it's just having that balance of knowing I have a problem and I need to do certain things to stay recovered or in recovery, whilst also knowing, for example, I have a job. I'm also a mother. I also have hobbies. I have other parts of my life that are also important. So I'd say that it is important, but I think it's not important. It's also important to recognize I have other identities in my life. It's not who I am. It doesn't define me as a person. Yeah. But I don't know if there's a model answer here.
So, because the addict is very vulnerable before entering the program, and they're very helpless and كل حاجة. So when they enter the program, like there's an elephant in the room, and then it's addressed very strongly. So how do you, as a therapist, how do you smoothen this transition, or is it a very ugly transition of it's very shameful, we don't address it, it's so ugly, people perceive me as diseased, and then going into a program where you're accepted, you're loved. But how do you kind of فاهمة يعني connect this to that.
You mean like the 12-step program?
Not necessarily
Or just
a
any
12-step.
treatment program?
For example,
Yeah.
in DBT or
Yeah.
in any program that you initiate. Yeah.
I think that this shame is important, and to work with that shame, to say this is what I have, because a lot of times addicts feel shame, and that's what prevents them from actually doing something about it, because of how terrible they feel about their condition. So it's actually important to say, in the safe space, to say, it doesn't mean I go out and like tell everybody about it, but it's important in the therapeutic context to expose themselves, so to speak. To say, this is what I have. And that's, I think, the benefit also of saying, hi, my name is so-and-so and I'm an addict, to reduce that shame. Because it's so shame, like it has been reinforced, like this is about, like I do things and I feel really shameful, so I use even more. But saying it in a place where I know I'm not going to be judged, or I know that people will accept me, and I know it reduces that. And the more we do that, that's one of the DBT skills of like acting opposite. Like I feel like, gosh, nobody's going to accept me. People have been judging me. I'm a worthless, horrible person. I'm a bad person. I do that, and the shame goes down. So it's important to say that and to do it, but doesn't mean you're going to go to the supermarket and tell the guy at the cashier that, yeah, by the way, فاهم قصدي? Yeah. Yeah.
Noor, question?
Hi.
It was really interesting when you mentioned how women are often overlooked when it comes to addiction more than men. So I'm really curious, do you see any difference between how women go through addiction and how men go through addiction? Or مثلا, do you see attachment and trauma coming up أكتر when you're dealing with women, or correlation between addiction and attachment and trauma when it comes to women أكتر, or can you make the correlation أكتر? Is it clearer when you're dealing with women?
I think women have more difficulty reaching out and asking for help. And I see a lot of women definitely like with sexual trauma. It's very, we see it a lot. And I think one of the biggest factors that in recovery women struggle with is relationships. I think both, or maybe both women and men, but it continues to be a problem. But again, women, depending on their cultural background, ما ينفعش عيب حرام مش متربية يعني it's more prevalent. We shouldn't go seek help أصلا to begin with. Yeah, I think women in general, like their ability to seek help and to ask for help is less talked about. Yeah.
And to recover as well.
Yes.
It's like a prolonged process because they reach out later.
Exactly. And even when you look in the recovering community, majority are men. Like even just to sample it, it's 2/3 men, 1/3 women. Like it's very. I don't know why. Are there women who are less addicted, or are there less women reaching out, or I don't know.
I think it's quite the opposite when anything has to do with there's دايما they seek psychological help more than men in general. That's why with addiction it's quite the contrary. It's quite contrary.
That's fine.
I don't know.
Interesting.
And this is what I've noticed.
Yeah. Noor?
So you mentioned how addiction, especially in our setting, maybe could be a family disease. But maybe stepping away شوية from the relationship between a child who could be struggling with something like this and a parent. In your experience, have you noticed how this thing impacts other members of the family, their attachment, مثلا siblings' attachment to their parents, أو العكس? How having a child who's struggling with something so big, how does this impact my relationship with
The rest of family? Yeah.
My children's relationship with me? Have you been able to notice this dynamic in your experience?
Certainly, some other members of the family become disconnected and detached, and they're not included or share the despair with the family. It affects everybody. Whether also there's financial stress, using or like treating a family member with addiction is costly as well. So therefore, there's more kind of load on the family. So that creates a lot of pressure in the family as well. Another family member may not get the same attention as well if somebody's really focused on the person who's unwell. So it certainly does affect the whole system.
This brings to mind Midterm, the series, which if some of you
Haven't seen
have
it.
watched it, because there was this particular dynamic of one person who was struggling with addiction and how the dad was very much focused on the other child, the other son, and feeling like أكن خلاص أنا ما عندي ابن واحد وما عنديش ولدين. And then at the end it turns out that the father was actually dealing with addiction issues when he was younger, and this son was bringing up these issues and triggering for him. But there are so many things that can actually happen. I think it can be a pretty complicated dynamic, and it's one that requires a lot of awareness come in, because you might be having a reaction and it's not really about the person but about what is triggered in you because of that behavior. So I guess it can be complicated. يعني. Yes.
Thank you so much for your talk. I was really passionate about it because as a clinical psychologist, I work a lot with people who struggle with addiction, especially with eating disorders. And actually, one thing came up when we talked about this gender difference that really is interesting to me, because I treated mostly young women who had eating disorders, which is kind of like addiction to the void, addiction to not eating, to becoming extremely thin, which is also linked to body dysmorphia, all of these things. And there you have 10% of men only, which it's still a dark number because there's not much detection right now, but where it's the opposite actually with the gender gap. And I think that drug abuse and substance abuse is extremely stigmatizing no matter which cultural context for women. And I think they struggle with it for a very, very long time because before they hide it from their kids, they hide it from their families, before there's really the escalation where they can't take care anymore because they're still in this role of I have to take care, I have to be a good mother. This is the first thing. And for me, the other thing is also today we have this tendency, of course, to talk about society that makes addiction more prominent in different societal contexts. But I still find it very important, I don't know what you're thinking, to distinguish between a clinical disease and addiction to the phone, to the internet, something more. Because when you meet these patients, you see they cannot function. They cannot go to work. They cannot have relationships. And for me, it's a deeply troubled relationship that you always find with people with addiction.
100%.
This is this trauma you're talking about.
Yes.
And this is why AA meetings are so great, because you share this experience. Hello, we have the same problem. This is our common ground.
100%. Yeah. 100%. Yeah. I think using the term very broadly is really saying like we're all addicted, but we can be. But to have that, it's impairing my life. I want to stop. I can't. I don't want to go steal, right? But there's something in me that's making me do it, and I can't function as a human being. That's when it becomes like a drug addiction, and people can't function in society. I can't maintain these relations because it's way more, reinforcing for my brain and for survival to use drugs than to go sit with my family. But yeah, I agree with you. It's not to just overuse the term. 100%. Yeah. Thank you.
Any other questions?
I have a comment.
Yeah, please.
I study issues. I really relate to this whole hot topic of whether people should be encouraged to call themselves addicts. I think the biggest issue people struggle with is traumatic invalidation, and usually clinicians can be on either end of the spectrum. Either the buzzword, like psychologists, for instance, when they hear addiction, no, you shouldn't do that, and some other clinicians, it's all about the brain. And actually, the person that gets left behind is the person struggling. So it should be like a bottom-up approach where you really understand what's going on with the person. Because if it's an attachment issue, so once the person uses the therapeutic environment and the relationship, and they start feeling more secure, they're going to explore themselves more, and their identity will expand no matter what. If you try to push an identity to begin with, whether it's you are an addict or not,
that makes sense.
You're just reinforcing it.
Makes a lot of sense, yeah.
It happens by its own self once you feel it.
Really makes a lot of sense, yes. I agree. You remind me of human connections create neuronal connections. So like these human connections are so important for our brains to start to create these normal connections that include the opioid system, the related dopamine system, and oxytocin. So it's so important to foster these human connections so that we can form, attachments. And then, like you said, I like how you said that, like bottom up. So to create safety within the therapeutic relationship, that's so important. As opposed to just like, this is who you are, and yeah, I really, really relate to that. Thank you, Shri. Yeah.
And actually, I have a follow-up question to what you guys were discussing. And I love how you guys were talking first about how there's kind of two aspects of like, aside from the addiction, there's also usually trauma or issues with physical attachment, relationships growing up. And in the therapeutic context, the question that comes to mind is then what to start with. Because you can, and here I'm not necessarily talking about like hospital settings where the person is completely impaired, they're not able to function, but more so in outpatient settings. You start then with addressing the attachment disruptions and the trauma, and then they can still kind of allowing them to still use the drug as a crutch or whatever they're using as a substance. Or do you start the other way around where you kind of try to behaviorally intervene there to kind of interrupt that, and then move on afterwards to attachment and trauma to promote growth and all that. So what do you usually do first, or does it depend?
I would start with whatever they're willing to commit to. Honestly. If they're willing to first to come to therapy, for someone who's been avoiding therapy or not willing to seek help, that is an amazing start. For people who are really in hell and have a lot of trouble, stopping to use drugs, it's a huge commitment. Let alone say, let's work on the trauma. So we'll work on let's develop a relationship here. Let's develop, let's get, know I'm here. If anything happens, even if you use, I'm still here. That's an important thing with substance users, because they're not used to that. They're not used to that. They're used to, if you use, you can imagine. So that's the attachment. I'll work on that, and it depends. It really depends on what they're presenting with. If it's someone who's at risk, then we work on the at-risk part and in the mental state of either they're suicidal. But again, if it's trauma or addiction, it's addiction. We need to work on stabilizing or using making sure the brain is first off the drugs, and then. But it's really important to validate the trauma, to ask about it, to say this was a difficult experience. Because that on its own makes a huge difference with people. Because people will say, oh yeah, I was hit by my parents, and Okay, 1 second. Okay. 1 second. And that's not, because I know I didn't have good grades, so my dad beat me up or locked me up. This is not normal. Maybe it seems to be normal for a lot of people, but it's actually not very normal, at least from my perspective. And then all these maladaptive ways of coping, of really, really having to prove yourself and be perfect. And so that's so I don't know if that answers your question. Yeah.
Yeah, you have a question.
I have a follow-up on something you just said. Even if you lose, I still be there.
Yeah.
Is this a normal thing to say as a relative or as a friend? Because in some way they also want to be supported. For example, as a friend or as a mother or anything, I want to be supported and I want to be with you no matter what. But then at some point, you don't really want to say, okay, so even if you're using, I'll still be there and I still love you. You want to stay, not to stop unless I do whatever, so that they feel threatened and they stop.
Yeah.
I know for a therapist, this is what you can do because it's okay. But as a friend, but as someone they really, really want them to stop. Is this the right way, or are they enabling them to Carlos, you love me anyway, so I just keep on going and grab it.
I think we can't threaten anyone, like using that approach of, tough love. Yani never. I don't see this as an effective way. I think it's very kind of people to help someone want to change, but if we do it in that approach, we may not be helping them. And it really depends on how much, what you as a person, and you being true to yourself. If you can manage to still be with this person for however you can tolerate, then you're being true to yourself. But if you're neglecting yourself and neglecting your needs and neglecting, your life, your hobbies, your spiritual life, everything that you know about yourself you're not doing, then you're not being true to yourself. And in the frame of attachment, that is a relationship. So an attachment relationship is formed on like authenticity and truth and being connected to yourself. So it's important to model also truth in this relationship. I can't do this. I love you and I can't do this. I want to be with you, but I can't support you in this way. As opposed to, if you don't do this, I will do that. Because that's a very parental, like authoritative, I'm going to, judge you, and they're used to that. And that pushes people away. It pushes addicts away. It makes them isolate even more. I don't know if any, yeah?
Any other
it's
questions
a difficult scenario, honestly.
Yeah. Thank you so much.
Thank you, everyone. I really am very grateful to be here. Thank you so much.
This is such an eye-opening conversation.
Thank you,
thank you
Noor.
so much for bringing in that approach and that perspective and trying to raise awareness also about this. فبجد thank you.
Thank you.
That's
thank
very
you.
important.